Whoa, dude, what's your problem?
Yo, you got a problem?
Yeah.
Yo, oh!
Oh no, I better call this in. Hi, I have 2 patrons that got in a bar fight. One is on the ground and unconscious and bleeding from his arm. Can you please send somebody's stat?
Attention all units, we've got one male down at a bar. Witness says they're bleeding from their arm and they may have gotten knocked unconscious. All units respond.
Unit 167, we're responding to a patient at a bar with an arm bleed. He's unconscious. We're on our way. All right, we're walking in. Our seat is safe. We have our PPEs on, and it's an MOI.
Number of patients is 1. Additional units would be fire, ALS, and PD, and then C-spine.
All right, Jordan, can you stabilize that head for me? We have a unconscious male with a right arm anterior bleed. I'm getting the tourniquet out. Here it is. I'm gonna go up to him, and first I'm gonna check his CSM. I'm gonna check his pulses. They are bilateral weak equal pulses. I'm gonna ask him if he could wiggle his fingers for me. He does not, since he is unconscious, and I'm gonna see if he could tell which fingers I'm touching. He can't because he's unconscious. Now I'm going to go to the tourniquet. Since it's on his ulna, I'm gonna apply it on his upper forearm about 2 to 3 inches above. Alright, I'm going to do it just one time since we're not actually live here. Don't want to tighten it too bad. I'm going to stick it into the latch. I'm going to close this up and I'm going to do T for time. It is 1913. So I'm going to write that down. I'm just going to secure this over here under the windlass. And then I'm going to check his CSM once more. I'm going to check his pulse. It is absent on the right but weak on the left. I'm going to ask him if he can wiggle his fingers. He can't because he's unconscious. I'm gonna ask him if he can tell which fingers I'm touching. He can't because he's unconscious. All right, since the tourniquet's on, we're gonna check his LOC. Sir, can you hear me? No response. I'm gonna do a sternum rub. Still no response. Patient's unresponsive. All right, now we're on Airway. Jordan, can you do a jaw thrust?
Doing jaw thrust. I do hear some gurgling if you want to go ahead and prepare the suction.
All right, I got the suction right here. And apply it, and then before I use the suction, I'm going to push this in. And I'm gonna make sure, I'm gonna hold it until we can get to 300, what is it, PSI? Sorry. 300 PSI. It did get there, so now I'm gonna go in without turning it on. And then since we're in, I'm gonna hold it. I'm gonna do a maximum of 15 seconds. 15 seconds up, and then I'm gonna swirl on my way out. And since our airway is clear, I'm now gonna put a OPA in. I'm gonna measure alongside his bottom of his ear and his lip. It looks good. Now I'm gonna put an OPA in like this, and then I'm gonna twist it, or I'm gonna go like this. Now I'm gonna twist it, and then it should stay in for that airway. And then for breathing, I'm going to auscultate his lung sounds. Oscillate, I mean. I'm gonna start here. Okay. All right, lung sounds are clear. I observed the rate and depth. It's rapid and shallow, and he also has equal chest rise and fall. Knowing that, and since he's also unconscious, I'm gonna give him a BVM. Jordan, can you stabilize with your knees?
Yes, I can.
All right. Give that to you. And can you hook him up to the oxygen over there?
Okay, it's hooked up.
All right. Go ahead and start bagging him. And then for circulation, we are going to assess his skin. He's pale, cool, and diaphoretic. We are now going, and then I'm also going to check his pulses once more. They are weak pulses. Knowing this, we're going to treat for shock, and I would put a blanket under and over for thermal regulation.
Okay, the fighters are here.
Okay,
What do you guys want me?
Yeah, can you come stabilize this and as well as breathing as well?
Yeah, where do you want me to put the longboard?
I'll go right here.
Okay, we'll go ahead and check, do a rapid scan. So I'll go ahead and check back of the neck for any crepitus. This is all good here. Checking both arms. All clear here. Checking any chest abnormalities or lacerations or anything right here. This looks good. I'll go ahead and open the pelvic area. And then I do feel some crepitus, so I'll go ahead and note that afterwards. We'll go ahead and check lower extremities. Right leg is good, left leg is good, and then we'll go ahead and use the pelvic binder. Right.
Yeah.
Oh. Thank you. Okay. Thank you. Go like that for you. Perfect. We'll go ahead. You can lift that lid. Then go ahead and shimmy up.
All right, we're gonna use the greater trochanter bone for our target on where we want to put it. All right. Now we're gonna do C-spine. Handle that. All right, I'm gonna measure 4 fingers here. Looks like it's good. Measure 4 fingers here. Looks like it's gonna fit. You wanna put it on, Jordan?
Yeah, go ahead. Before I do that, I'll go ahead and check again, just to double check, make sure anything.
Check CSM too. Comes before.
Yep. And then we'll go ahead and check CSM. Go ahead and check bilateral radial pulses. This one's absent. We'll go ahead and check fingers. Although he's unconscious, just want to double check and then see if he's moving at all. Yeah. And go ahead and check the pedal pulses. Nothing there. We'll check for wiggle. Obviously he's unconscious, nothing. And then notifying anything, any capillary pulses. And then we'll go ahead and check the Babinski's. There is reflex on both ends. Okay, stable. We'll go ahead and check CSM. Again, absent on the right. Weak on the left right here. Just making stimuli. Stimuli as well. Nothing. We're checking both. Pedal pulses. Weak. So is that. And then this piece.
Perfect. All right, we're ready for backboard here. We're gonna have another firefighter handle the breathing so that the goat Sam can handle the stabilization. He's also gonna do the count so that we can get him on a backboard.
Okay, everyone ready?
Ready.
3, 2, 1.
Since we have him turned over, I'm gonna check his spine. I'm gonna check the cervical spine, the thoracic spine, the lumbar, the sacral, and the coccyx. Those all look clear for deformities. Now we're gonna roll them on the backboards. On your count.
3, 2, 1.
All right.
Okay, we're gonna slide him down. 3, 2, 1. A little bit more. 3, 2, 1. Perfect.
All right. All right, the patient is now on the backboard. We're going to secure him with the strap. We're going to make sure the belt buckle is towards the latch. And we're going to attach it. All right, and then we're going to tight as much as possible in this scenario. All right. We're going to move on to the feet. This one's just good. And we're going to tighten as much as we can into the scenario as well. You want to pull out? I got it. All right. We're now going to go to the head. Put them on the side here. We're going to use tape. We're going to do one on the actual cervical collar. I'm going to use the trauma scissors. All right. And then now we're going to do it on his forehead. I'm going to use my trauma scissors again here. All right. Since he is strapped into the backboard, I'm going to do CSM one more time. We're going to check his pulse in here. It's weak on the left, absent on the right. I'm going to ask him still if he can wiggle his fingers. He cannot because he's unresponsive. I'm also going to touch his fingers to make sure he can tell which one. He can't because he's unconscious. I'm also going to go down to his feet. I'm going to check his pedal pulses. They are weak. I'm going to ask if he can wiggle his toes. He cannot because he's unconscious. Then I'm going to do Babinski reflexes, and they react. And then now since we're all done with that, I'm going to transport my patient to the nearest trauma center. I'm going to recess every 5 minutes. All right, now we're in a history. We cannot take an adequate OPQRST or sample and do this time because this is a stat patient. I did check for medical equipment such as bracelets and necklaces. He doesn't have any of that. So now we're gonna move on to our focused exam. I'm now gonna get up and I'm gonna assess his ears, his eyes, his nose, his mouth, his scalp. Everything seems to be clear. I'm gonna check his arms once more, check another arm, make sure that this is working fine. Since we're here, I'm now going to put gauze as well as a bandage on him. All right, I'm going to bandage him up now. And if it continues to bleed, we're going to wrap it, but it's not because he has tourniquet. All right. Let's put that. All right, since his arm is good, we're going to check his other arm. Seems good. We're going to check his chest. We're going to palpate the chest. Everything looks good. We already have a hip binder on. We're going to check his right leg. Bang, we're good. Check his left leg. We are good there. Since we are focused exam, we're not going to check body systems just because it's a stat patient and it's a trauma. Since we just wrapped up his arm, we finished our focus exam. We're going to now assess his vitals. I'm going to take his left one because his right one has no pulse. Take his left. I'm going to sit here. I'm going to calculate it for 15 seconds. Okay, his pulse is 50. I'm now going to get his blood pressure. His BP was 80/50. Not looking good. He seems to be in shock. All right. Now we're going to check his lung sounds. Lung sounds are clear, and his respiratory rate is 20. All right, vitals are done. Focus exam is done. I'm now going to reassess my patient every 5 minutes until we transfer care.
Okay, for our pathophysiology, we had a patient with both blunt and penetrating trauma. Penetrating to the right arm, blunt kind of to the chest, pelvis region. For treatments, we took care of the bleed on the arm with a tourniquet. Airway, we suctioned our patient's airway and put OPA in to protect it. Breathing, we put our patient on a BVM because they were unconscious. Circulation, we treated our patient for shock with a blanket. We immobilized our patient's C-spine, strapped him to the backboard, and reassessed every 5 minutes as they were a stat patient. All right, and then ALS treatment for this patient would be cardiac monitoring, IV access, and advanced medication. Whoa, dude, what's your problem, bro?
Yo, oh! Gotta redo that. I was laughing.
No, let's see.
What am I saying?
Gersh! To say Unit 67 responding to
You know 167 responding.
Perfect.
I'm gonna use my trauma scissors here. I don't have them. I'll keep going.
Is it playing my shoe?
No, it's trying.
Oh.
So then this is my script. I'm gonna say, we're now on history. We can't take an adequate OPQRST or sample just because of the
Lack of consciousness.
lack of consciousness
And the lack of medical,
and the lack of medical equipment.
what do you say? Medical bracelet?
Medical jewelry. How do you say jewelry?
Jewelry.
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 Jewel?
Did you say Jew? Did you say jewelry?
Jewel?
Jewelry.
I'm saying jewelry.
Jewelry.
Have the thing.
Jewelry.
Just say
Okay, it's securely wrapped.
Now I'm just gonna wrap it.
Okay.
Bang, I'm gonna put this here. And then I'm just gonna grab this. I'm gonna go dum, 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 dum.
I stabbed him.
You can literally just do
I
that.
stabbed
motion
him on
and
the
say wrap.
outer arm.
Well, why not just wrap? We have the equipment here. We already have a damn tourniquet on. You just put you on a backboard. What's the issue with just wrapping bandages on?
I'm
it?
just curious why you want to, like, why do you just want to say you did it and keep going?
Because we strapped him in a seat collar. We put him on the backboard. We strapped him in. We did everything, but we're gonna stop at bandaging him.
Just do it. Just do it.
We're gonna stop at we're gonna do everything, but we're not gonna.
Well, I mean, like, we were gonna do it on the floor before.
Can you come in?